West Lafayette Schools, West Lafayette Mayor John Dennis, County Commissioner Tracy Brown, Lafayette Mayor Tony Wazworski, Dr. James Bean from IU Arnett, and Dr. Wickert from Franciscan. We'll begin as we usually do with a review of our local data. This first slide summarizes the 5 data points that we have been monitoring with regards to the COVID-19 pandemic in our county. The first is the number of new confirmed COVID-19 cases. The second is the percentage of COVID-19 tests that are positive. This is also known as the percent positivity. The third is the number of COVID-19 hospitalizations, including the number of patients in intensive care and on ventilators. Fourth, the number of emergency department visits for respiratory illnesses. And lastly, the number of deaths due to COVID-19. This slide summarizes our cumulative COVID-19 data. As of today, we have had cumulatively 9,911 cases in Tippecanoe County. Of note, over 5,000 of those have occurred in the last 28 days, so more than half have occurred in the last month. In the last 7 days, we've had just over 1,300 new cases. 4,359 individuals are considered to be recovered. We've had 33 deaths, leaving us with 5,519 active cases in our county. This slide shows our daily new cases of COVID-19 dating all the way back to the beginning of the pandemic in March. As you can see, recently there's been a very steep incline in the curve. We did see a little bit of a dip in the last week or so over the holidays, but the numbers are starting to trend back upwards. We had 269 new cases on Monday and have 264 new cases for today. This next slide shows the average daily new cases by week. And as you can see, the shape of this curve is very similar to the last slide, a very steep increase here recently with a little bit of a decrease here in the last couple of weeks, going from 213 cases on average per day down to 192 and then 191 so far for this week. Here in the county, over 79,000, actually almost 80,000 individuals have been tested for COVID-19. In the last week, over 3,000 individuals have been tested. Our current percent positivity is 9.1%, slightly lower than the state at 11% and slightly lower than the country as a whole at 10.6%. This slide shows the trends in our percent positivity. As you can see, we've had a slight decrease in percent positivity from 11.2% last week down to 9.1% this week. Of note, the percent positivity did drop to 8.2% on Sunday, November 29th, and it is now increased back up to 9.1%. So we'll be watching that trend very closely. This next slide shows our peak hospitalizations for COVID-19 here in the county. As you can see, a very sharp increase in hospitalizations for COVID-19 with 119 cases in the hospital today, 29 on ventilators, 29 in intensive care and 21 on ventilators. So we're seeing a very large number of individuals hospitalized for COVID-19. This data is combined data for both the IU Arnett Hospital and the Franciscan Hospital. This slide shows the number of ER visits for respiratory illnesses in our county, and as you can see, those numbers have also increased to 273 last week, the highest they've been since early May. So this is another indicator of the amount of COVID-like activity, COVID-like illness in our community. And lastly, I wanted to include an update on our school data. This is combined data for all schools and school systems in Tippecanoe County. As of yesterday, December 1st, we've had a total of 584 confirmed cases of COVID-19 in our schools. 451 of those are students, 132 staff, and 1 student teacher. This has resulted in a total of just over 5,000 individuals, close contacts being quarantined. So although we saw a slight decrease in cases over the holiday weekend, our daily new case numbers are high and could increase substantially during the next 2 weeks due to holiday gatherings. The county's percent positivity did drop below 10% on November 29th, but it is unknown if this improvement will be sustained as it is starting to rise again. The local hospitals continue to care for very high numbers of COVID-19 patients, and the patients in the hospitals are sicker than earlier in the pandemic. Testing sites continue to be busy with longer wait times for testing and results. Contact tracers are contending with hundreds of new cases each day, and unfortunately, deaths due to COVID-19 are rising. For now, the county remains orange on the Indiana Department of Health COVID-19 county metrics map, but we could become red in the next few weeks as community spread remains high. The public health orders limiting capacities at retail businesses, gyms and fitness centers, cultural and entertainment venues, senior centers, restaurants, and bars in an effort to reduce the spread of COVID-19 will remain in effect until the 7-day all-test percent positivity remains below 10% for 14 days. I realize these restrictions present many challenges, but they are necessary to reduce the spread of COVID-19, and I appreciate everyone's cooperation with these measures. My message to you remains the same. Please do your part to help fight this pandemic. Each of us plays a role in keeping our community safe and healthy. Your actions really do matter. Please wear your masks, maintain social distancing, wash your hands frequently, avoid crowds, stay home when sick. If you test positive for COVID-19, please remain isolated for the recommended time. If you are a close contact, please quarantine for the recommended time. Please cooperate with contact tracers. This is how we slow the spread of this disease. There are promising vaccines on the horizon, but for now, we must resist pandemic fatigue and continue all the preventive measures that will keep us safe and healthy. Thank you. At this time, I'd like to turn the floor over to Dr. Rocky Killian from the West Lafayette Schools, who would like to make a statement on behalf of the schools in the county.
Thank you, Dr. Adler. Good afternoon. On behalf of all Tippecanoe County school leaders, first I would like to thank Dr. Adler, Mr. Houston, and the Tippecanoe County Health Department staff for their ongoing collaboration with our public and non-public school leaders during this very challenging time. As Dr. Adler has said before, there's not a one-size-that-fits-all approach for our respective schools. Each school, each community is different. Also, our school leaders are educators, so we rely upon the medical professionals, Dr. Adler, school nurses, school district physicians, to provide our school leaders with real-time recommendations based upon the data tracking for each school. Some people think that the superintendents and school boards might have autonomy to make these decisions, but as educators, we rely upon the professionals to help us make those decisions. While the number of positive cases remain low in our schools compared with county and state averages, we are mindful that we must make decisions about our schools on a daily basis and make those decisions based upon the recommendations we receive from Dr. Adler, the medical professionals, and the Tippecanoe County Health Department, who are working with our school leaders every day. As Dr. Fauci said on Sunday, children should be in school if we can do so safely. If the county should go red, our school leaders have agreed to take a measured approach to determining what should be done based upon the recommendations of Dr. Adler and his staff. For instance, if the county goes red and if our schools' positive case numbers remain low, so long as we have the appropriate staffing, we will continue providing on-site instruction to our students so long as we can safely do so. If one of our school districts sees a spike in positive cases, a measured approach might include closing down classrooms, a school, or the school district. These decisions will be made on a case-by-case basis for each Tippecanoe County school and based upon the recommendations we receive from the medical professionals and Dr. Adler and the Tippecanoe County Health Department staff. In closing, on behalf of our school leaders, I want to thank our respective students, parents, teachers, support staff, administration, school boards, and community members for everything they are doing to help keep our students and staff safe during this time. And again, I want to thank Dr. Adler, Mr. Houston, the Tippecanoe County Health Department staff, school nurses, and district physicians for providing the medical expertise we need during this critical time. Thank you.
Thank you, Dr. Killian. Before we open the floor to questions, I did want to welcome Mayor Zworski back and let him know that we're glad you've recovered and we're glad you're back with us.
Thank you. I'm glad to be back with you. Thank you.
Thank you. At this time, we'll take questions from the media and from our Facebook Live audience.
Question for Mayor Zworski. Can you talk about your experience a little bit?
Yeah, I mean, I think it's probably close to the same experience a lot of people have had that have kind of, I would say, mild to maybe moderate symptoms. I was very fortunate. I mean, I had a dull headache and some body aches and fever for a while. Fortunately, I didn't have the respiratory distress that a lot of people experience that can be very dangerous with, you know, your oxygen going down too low. I didn't have that, which was very fortunate. So after about the first 6 days, it began to subside. My fever broke and things, and after that, it was kind of just feeling tired. So, you know, I guess I'm probably one of the lucky ones compared to what some people are having to deal with and going through in hospitalizations. And so I got back to work on Monday, and I'm feeling good. And like I said, I had my family bought an oximeter, meter, is that correct? The terminology for my finger. And I thought I could have swore they had cameras in the bedroom because I've even took it off. It was like, what's your blood, what's your level, what's your level, what's your level? So I had a lot of people keeping a very close eye on me to make sure that everything was fine. So thank you for asking.
Well, it's good to see you back, and you look really good. Have you modified any of your behaviors, or do you know how you contrasted it?
You know, we've went through that. You know, my wife tested positive, I'm negative, I'm sorry, my wife tested negative, my daughter tested negative, her husband tested negative, the other grandma that helps watch her tested negative, Lisa tested negative, my secretary, and so the controller tested negative. So the only two people was Brandy and I. So I don't know if maybe she had it when she filled in for Lisa one day, or somebody came into the office that had it, because literally I didn't have anybody that has a positive test that I was around that I've been notified of. So that's why we have to be careful, because you just don't know for sure. And we were doing 95% of all my meetings by Zoom, probably. Thanks, Jeff. I appreciate that.
Dr. Edwards, have you or anybody...
Could we ask you to step to the microphone so that folks out Facebook?
Dr. Adler, I'm just wondering if you or anybody in your office or in your sphere of people have received, I guess, threats or that sort of behavior from the public?
Sure. I am not aware of any threats that any of us have received. We clearly hear from people with opinions on both sides of the issue here, and some in support of what we're doing from a public health standpoint, some who are opposed to it, and that's certainly fine. People certainly have the right to express their opinions about what we're doing. We're happy to explain to individuals why we're doing what we're doing, but as far as I'm aware, none of the staff have received any threats.
And can you talk about what you, and maybe the doctors could weigh in on this too, what you saw in terms of Thanksgiving travel? Talk about the upcoming Christmas holiday and what your expectations are for that.
Sure. Well, I don't have any data about what sort of travel our local citizens did over the holidays. I did find out this morning that our contact tracers have already linked 7 of our new cases to Thanksgiving gatherings. So certainly there's a possibility that that number will increase, and it probably will. The incubation period for the virus is between 2 and 14 days, so some people who were exposed over the Thanksgiving holiday may not develop symptoms until later this week or even next week.
Emily DeLetter at the Journal and Courier. I saw the CDC recommended today that quarantine can be shortened from 14 days to 7 to 10 days. Do you have any thoughts on that, and will you be recommending that practice here as well?
Sure. Yeah, I also heard the same thing. I have not actually seen the actual document from the CDC, but certainly if that is the recommendation from the CDC, then I am assuming that the State Department of Health will also adopt that recommendation, and then we will also follow that.
I also wanted to get an update on the recent reports of the cluster of cases at T.C. Harris Academy in Lafayette. Do you have any updates on that?
No new updates compared to yesterday. The facility is working as hard as they can to contain the outbreak and prevent any new cases from occurring.
Emily Seiberg from WBAA. Just quickly first, can you talk a little bit about what went into the dip that we saw? Was it just not as many people getting tested over Thanksgiving? You know, it obviously went down a little bit, now is going back up. If you can talk a little bit about what went into that.
Sure. So I think that, yeah, during the holiday week, there probably were fewer people getting tested. The lab was closed on Thanksgiving Day. Were they open the day after Thanksgiving? The lab was? Yeah. And in addition, Purdue students left, so those numbers are not part of our county's count anymore. So I think it's probably a combination of those things, and it looks like, you know, as of this week, it's sort of back to where it was before, so we'll be watching those numbers closely.
And then secondarily, I know with Thanksgiving, it's kind of a one-shot holiday. You know, the recommendations as we got closer to the holiday got more and more specific. You know, really a strong recommendation: don't get together with people outside of your household. And now it's December, and we're kind of heading into what really is kind of a month of holiday. Lots of different traditions, lots of different types of gatherings over kind of a broader range of days. So are you thinking about, you know, how to frame recommendations around that? Are they going to be as specific and direct as they were with Thanksgiving? And when are you prepared to make that call?
Sure. So I think, you know, a lot of it will, of course, depend on what direction our data goes from here. In anticipation, though, of our numbers here locally and across the state and across the nation continuing to be high, I think you'll probably see a lot of the same recommendations to really strongly consider curtailing or avoiding gatherings for the holiday. If they are done, then social distancing and mask wearing will be very important. And that recommendation would also extend to other holiday gatherings, office parties, things like that. We need to really think very long and hard about whether it's worth the risk to do those things this year. And in many situations, it may not be worth the risk, and certainly keeping things smaller is going to be safer, and reducing our prolonged close contact with others, particularly in close social situations where masks may not be worn. That's going to be very helpful to reduce those situations.
Question from Allie with the Journal and Courier. Is the virus spreading inside classrooms, or are we seeing more community spread outside of school buildings?
So far, we've seen more community spread outside of the school facilities. We have not seen spread within the classrooms or the school facilities as a major factor thus far.
Are you getting good buy-in with the contact tracers?
Well, you know, the contact tracers have had some difficulties recently. They've had times where, unfortunately, individuals won't be forthcoming with information about who their close contacts are. They may refuse to speak to the contact tracers at all. And those situations are unfortunate and make containing this virus a lot more difficult. We have to rely on that contact tracing, identifying close contacts, quarantine, to really slow the spread of this virus. So that's why we are really emphasizing that it's so important to cooperate with the contact tracers and the contact tracing efforts, because those things really do make a difference. And those are the best tools we have right now until we have a vaccine.
For the doctors, if you could kind of describe conditions at the hospitals in terms of COVID?
So I'll start and speak for IU Health Arnett. My report's going to sound very similar to last week. We are under stress. The hospital is at capacity almost all the time. As soon as we discharge patients, there are patients waiting to be admitted to the hospital in our emergency department. Currently, we have 61 COVID positive patients in the hospital. We have 9 patients with that disease who are on ventilators. Our ambulance bay and our classroom capacity stand at the ready this morning, and I anticipate one or both of those will be used as the day progresses. People are tired. Our staff continues to be stressed, and we're dealing with the challenges that people needing to be out to care for themselves or their family members presents, and colleagues are being pulled in from other areas to support care within the hospital. Other comment I'll make is our 2 regional hospitals in Monticello and in Frankfurt are also feeling the same capacity demands. So I'll just take a moment to express thanks to community members who are doing what they can to mitigate their personal risk and their family's risk to become COVID patients. We very much appreciate the efforts and the sacrifice that all of us are making to do this. And I also want to acknowledge the retailers who are helping to continue to strengthen and establish a culture of mask wearing among people who enter their stores and facilities. It's very important, obviously.
So it's very interesting how both hospitals are very similar. So our numbers this morning were 60 related to COVID-related issues. We had 24 of those in the ICU of the 60. And the one thing that we have seen some changes that the individuals we're now taking care of seem to be more intensely acute. So we have 15 patients that are on ventilators currently at the present time, and they're all COVID related. And early on in the pandemic, in March, April, we were pretty much intubating everyone, and then we transitioned to trying not to intubate individuals. So we are seeing more high-intensity acute illnesses, individuals who are struggling more and requiring ventilatory assistance that we have not seen previously with these kinds of numbers. We're also feeling the challenge of staffing, as we have individuals who, I think early this week, we thought we had about 100 individuals who came back from being quarantined or isolated. However, there's another group of individuals who became ill within the past few days or need to be quarantined. So we're having this transition of turnover of individuals coming and going who can provide care to patients within our hospitals, within our facilities. We also are struggling in the same way. Our regional hospitals in Crawfordsville and Rensselaer are also at capacity. Crawfordsville this morning had 10 positive cases in Crawfordsville. So we're seeing this not just in Lafayette, but it's also in Crawfordsville, also in Rensselaer, that their numbers are also increasing, and they're at capacity also in the smaller hospitals. So it becomes a challenge of where do people go and where can we provide that care and how do we provide that care as we move forward. So we're all concerned about what would it look like if our numbers increased by 20, 30, 40%, and providing care for those individuals when that, if that would happen. So we're all, again, agree with the element about our staff is tired. And really want a shout out to our staff who try to work extra because they care about their associates. And so they work extra shifts, extra hours, and they are tired.
Question for the hospitals, kind of going off of what you just said. Have either hospitals looked into the possibility of overflow spaces should capacity, become a more serious problem? Overflow spaces, like renting extra facilities, for extra hospital beds and that kind of thing.
So we've not looked to renting additional space. We've, as you've heard me say, converted some non-clinical space into ward areas for appropriate select patients. One of the real challenges that we've both just identified is it's a staffing challenge on top of a space challenge. So our approach is to continue to maximize utilization of the spaces that we have and to staff a little bit differently, but recognizing that that's a restraint on us as well. We're also having more patients being offered the opportunity to transfer to Indianapolis if they have capacity down there, though they always don't, or they don't always.
Yeah, and for us at Franciscan, we are looking at those areas that we could utilize in a different way, in a different capacity, and how that could happen. Those discussions are ongoing and really depend upon the numbers that we see on a daily basis of how acute that need becomes and when we, in essence, pull the trigger to make some of these significant changes that would be a different way of cohorting and having people in the hospital.
And question for Dr. Killian, if the county does go into the red metric and, a certain % positivity is reached within the schools, is there a certain number, a metric that you would reevaluate the reopening plans?
Our evaluation is based upon the medical professionals. So if Dr. Adler, our corporate physicians, were to tell us to implement certain protocols, we would do that immediately. What we do is, as educators, we rely upon the professionals to help us drive those decisions. We're not medical professionals ourselves. So what I appreciate about Dr. Adler and our teachers and our administrators, this is almost a 24/7 type of approach where we're talking day and night, weekends, and at any given time, we could get a call to say, we need to implement these kinds of protocols and procedures. As long as we're have that collaboration, that communication, I think that, to me, that's the best approach because we're using the medical professionals to help us drive those decisions.
Question from Facebook Live. Do we have plans for vaccine distribution yet in Tippecanoe County?
That's a great question. Plans are being made. One thing to realize at this point is that we don't know exactly when we'll be receiving vaccine for distribution to the general public. That could happen sometime during the winter. It might be the spring. We haven't heard yet. We don't know when that happens, how much of it will we get in the first allotment. But we are starting to make plans for location for vaccine administration to large numbers of people. We've also made plans for appropriate storage of the vaccine. One of the vaccines has to be stored at minus 70 degrees, so that presents, of course, some challenges, but we've been able to secure appropriate storage for the vaccine. So plans are underway. There are still some unknowns, though, at this point.
So just on behalf of the public, I wanted to personally thank Dave Bangert for his many years of providing information to us all here. We didn't always agree, but he provided a very important function so we all would come to a correct decision, and we're all in this together. So in his spirit, I'd like to ask a question I'm sure he would ask if he's here. Can the hospital share any information on whether they're able to use some of the facilities at Purdue as far as the lab testing to help with the overflow at the hospitals, or is that still preliminary, or is there nothing you can share on that?
I'll be glad to share. We started using, as of Monday, started sending samples from our hospital drive-through testing which includes many of the individuals who would be pre-procedure testing. So we sent a number over 100 samples, I believe, on Monday, and plan on doing that for the next few weeks. We have some agreements with them for the next at least 2 to 3 weeks to hopefully offload some of the challenges that we're having at a corporate lab standpoint. So they are helping us, and we are very grateful for that.
Since they have a quantitative lab test and they can actually come up with a cycle threshold number, will those specimens you send over there come back with that information? Or will it be a simple binary yes or no like the old qualitative PCR test?
I believe at this point it will be a yes or no.
Yes or no. And then as a follow-up, do you guys know the numbers at the hospital of how many patients are in on remdesivir, their 5-day course? And if so, how many of those could be treated as an outpatient with that drug that might alleviate some of the numbers, or is that already being done at the hospital?
So I don't know the numbers. I can tell you that the change in treatment, I think we discussed this last week. So it's typically a 5-day course, but now if patients are well enough to go home, they don't conclude a 5-day course at home. They conclude whatever they are able to have obtained in the hospital. So I don't know that that answers your question, but
I guess some of the insurance companies are now allowing patients who need that drug to get it totally outpatient so that the hospital does not have an increased census with those people just in there to get an IV. It takes 30 to 120 minutes to infuse it. There needs to be some monitoring, and I know you guys have done a great job in the outpatient arena in so many areas in healthcare. Just wondered if that can help here to alleviate the census at the hospital.
yeah, my understanding of how we're handling it is what I've just described.
Okay.
And we have not implemented that at this point. So we're always looking at how we can implement outpatient procedures and what that looks like and how to do that. And that sounds like an easy process.
I'm sure it's not.
It is not an easy process to implement all of those changes, particularly in the element about where we're short-staffed as it is today, but we're looking at that extensively.
So if the CDC goes ahead with that 10 days if you have a positive test, if you're around somebody with a positive test, and 7 days if you then have a negative test, will that help some of your employees be able to come back to work, do you think?
Hope so.
I mean, their data that also they have come out with is that the infective period is not 2 to 14 days, it's 4 to 5 days,
Yeah.
which may modify that some. So,
We're hopeful that we can get employees back when they're able to come back.
perfect, thank you.
Another question from Facebook Live. For the doctors, how has the average length of stay changed since the early months of the COVID-19 pandemic?
Our average length of stay has gone up. And the individuals and now currently our average length of stay continues to rise. Those individuals who are ventilated tend to be in the hospital for a longer period of time. So those individuals' length of stay has gone up in the 7, 8, 9, 10-day range, as previous to COVID, it was in the 4 to 4.4 range. So we've seen a substantial increase in patients staying and how long they stay.
Agree, same.
So I guess actually related, why is it that the patients you're seeing now are struggling more? Why are the cases more serious? Do you have any thoughts on that? You had mentioned that there, yeah.
They are sicker. I don't have a good reason. I don't have well, they stayed at home too long. I don't have a good reason. We're just noticing that we don't have an answer for why. I don't have a good answer for that one.
Yeah, I don't think we really understand why. I'll speculate that more people are getting sick, and the patients that maybe we were admitting earlier in the pandemic that were less ill, we have home health available now, and we're supporting them as outpatients, and our triggers for admission might be different. But the people in the hospital are definitely higher acuity than they were earlier in the pandemic. There's more of them.
And then I guess for the hospitals also, I know that this is hard to predict, but at what point, are you looking at a timeline for when you're really, it sounds like we're kind of staying right at capacity right now. How far into December are you looking where you're really kind of, the alarm bell starts ringing and it really starts getting beyond that?
Well, I think the alarm bell's been ringing for a long time. So I don't think, yeah. So what's our, it feels to me that in the last few weeks, we've gone from what was a steady state, we took a big step up, and now we're at a new steady state. We have both facilities have restricted our scheduled outpatient procedure admissions. So our elective surgery cases have been capped at both hospitals, so that was sort of an initial step. That's being reconsidered almost on a daily basis. We are asking patients to postpone planned care that's not urgent or emergent in many cases. We are looking to when do we take more of our clinic-based staff and have them shift their work to the hospital. These are daily discussions that happen. Right now, we're doing a little bit of all of that in a way much more significantly than we were doing back in April and May.
Question from Facebook Live. Would both doctors like to see a mask mandate for the whole county rather than just West Lafayette?
I think any policy that helps the community better align with the public health practices, I would be very supportive of.
And we both have done recently, I did mine this morning, you did one a couple days ago, a public service announcement being on the radios now about, and one of the concerns is, the question is, how do I thank healthcare providers? Well, one of the best ways is stay healthy. Don't get sick if at all possible, which means the things we've been talking about: wash your hands, wear your mask, socially distance. We are for those elements to try to mitigate spread of the disease and keep people healthy as much as possible. Hospitals are strained at this point, and we don't want to see a 20, 30, 40% additional surge in the next 3 to 4 weeks. It is amazing how we went from a steady state early in the summer, now we're at a different steady state, and the implications of all these changes we'll just make these changes, but there are significant implications downstream, so the more radical changes that we have to think about and talk about.
I did want to point out that the entire state of Indiana has a mask mandate that applies, of course, to Tippecanoe County.
Another question from Facebook Live from last week that we didn't get to is for Dr. Adler. If the vaccine is available, will you be receiving the vaccine?
Sure, that's a great question. The efficacy data looks really good for the vaccines that I've heard about so far. I have not seen the safety data yet. From what I understand, the FDA is currently reviewing that data and is actually reviewing the vaccines for actual approval. And so if they are approved, then that would be a great indication that not only are they effective, but they're also safe. And then in that case, of course, I would definitely receive a vaccine.
This would be a question for Dr. Killian. A study done in Newport, Ohio, they had 300 students that tested positive for COVID. Because of that, they quarantined 3,000 students. None of those students ended up going to the hospital or subsequently coming down with COVID. So their conclusion was that we're quarantining maybe a few more people than we need to, and it sounds like the CDC may come to that decision. Western Boone School Corporation went to 3 feet instead of 6 feet. So with the 584 students and faculty that tested positive, the quarantine of 5,081, have any of those gotten sick or been hospitalized as far as you know, or maybe just in your school corporation?
Not that we're aware of. One of the things that I think has helped keep our rates low, and the work that and the assistance we receive from the Tippecanoe County Health Department and our corporate physicians, we're doing aggressive precautionary quarantines for our students and our staff. And so we try to give as much notice as we can to our parents and our community when we go through that process. But sometimes we have to do it immediately, and I think because we're so aggressive and erring on the side of caution with regards to the precautionary quarantines, that's what's helping us keep our rates lower within our schools.
And then as far as for the fourth time, I'll ask a question. Does anybody know what cycle threshold we're using for a positive test for COVID in our county? Can anybody come up with what that is? Are we using 33 or 30 or 40, or does anybody know?
Sure. So I did reach out to the State Department of Health with that question, and they were able to communicate with Optum. That's the company that runs the State Department of Health testing sites. And they relayed to me that Optum informed them that they utilize multiple regional labs for their tests, and they were not able to provide the cycle threshold values for the different tests at each of the labs. But all the labs are utilizing tests that have been validated and approved by the FDA's EUA process. So we can be confident in the accuracy of the tests. It's important to point out that they also expressed to me that all of the approved tests currently are qualitative and not quantitative tests.
Correct.
And the CDC and the Association of Public Health Laboratories has advised that cycle threshold values should not be used to determine a patient's viral load, how infectious a person may be, or when a person can be released from isolation or quarantine. And cycle threshold values should not, from different PCR tests, cannot be compared.
Certainly, but they could help the contact tracers if their cycle threshold number is very high, which means they're towards the end of their disease. The contact tracers would not have to call all the people on the list. They could focus on those ones that have the highest amount of virus in their system. So that's what Dr. Mina from Harvard has been saying. Dr. Gandhi from Stanford has been saying that if you had that number internally and you used it, contact tracers could focus on just the ones that need to be focused on, and also physicians could judge their treatment based on how positive that person is for COVID. Not as a means to get them out of quarantine, but as a way to decide who you need to focus your limited resources that you're telling us we have right now.
Sure, sure. Only that the CDC, who provides the recommendations and guidance for contact tracing, has said that that the cycle threshold should not be used to determine a patient's viral load or infectivity. So I would assume that would not change the contact tracing from the CDC standpoint.
Sure, except if, you get a stack of charts that big of people to contact trace, and everybody you call doesn't answer the phone or won't give you the information. If now it came out that we're really just going to contact trace those at the early part of their disease, that first 4 or 5 days that are most infectious, then those people, you could focus on them and find out where they're at. What we're using now isn't working. If what we were using now was working, that graph wouldn't go up so much. So it seems to me to try to change course a little bit and use cycle threshold as the measure of who to focus your energy on might be a better option than what we're doing here.
And again, that will be up to the CDC whether they change their contact tracing recommendations to include that.
Okay, thank you.
Another question from Facebook Live. Nationally, people still travel for Thanksgiving. What more can be done to convince people to stay home or act safely?
Well, I think it's going to be really consistent messaging and making sure that everyone is aware of the local and statewide and national COVID-19 surge, and that really what all of us do, the actions that we take really do matter. And it may seem like something we're doing may not be that big of a deal, but these things really do matter. They really do affect not only our own health, but the health of our families and our friends.
And also, can you please explain the difference between the unique tests and the all tests? There are people asking several questions about that.
Sure. So the State Department of Health, on their dashboard, they provide information about all tests and unique individuals. So all tests is just that. It's all the tests that have been run on individuals in our county for COVID-19. So that means that individuals who've had testing more than once are counted in that all tests. The unique individuals number only counts each person one time, so whether they've had one test or 2 or 3 tests, they're only counted once in that number.
I don't know if many of you received this this week, but this is from Mental Health America, located just a few blocks from here. And it's the numbers of people that have called them for a suicide screening or mental health screening, which, a lot of people in the community realize there's a lot of people that are having some issues. And the numbers went up from suicide screenings that Mental Health America did. 2019 were 79. Now it's 455 so far this year. Mental health screenings went up from 659 last year to 1,403. So does the county have any numbers as far as how many suicides, mental health deaths, overdose deaths, deaths of despair that have happened this year compared to the same time last year?
Yes, the county does have that data through our vital records division. I don't have it with me, but we can obtain that.
Okay, thank you. And how about the test cards, the antigen test cards? Are those, do we know any more about that? I know you said you might be able to find that out sometime.
Go ahead.
So some long-term care health facilities do have them. The jail is working on getting them, and so the jail will have them through the sheriff's organization, which will help with congregated situations there in the jail and community corrections. But they do not go to all congregated living, like a group home setting, or it's not considered a long-term care facility by the state of Indiana. They do not qualify for the BINEX cards.
Will schools qualify? I mean, if the CD changes as they say they're going to from 14 to 10 or 7 days, those cards would be excellent to sort that out.
They're not going to they did not find them to be accurate enough to use them in a school situation, is what the state just announced that this week on a webinar yesterday, actually. And there's not enough, so they're putting them in long-term care facilities first as the priority, because a congregated living situation would clearly be our top priority for testing.
Because that would certainly help sort those people out. If you have to have a negative test to get out of quarantine and it takes a week to get your result back, it hasn't changed, hasn't helped the CDC to make that change. So thank you.
Yeah, we're still waiting on the CDC's official guidance before we can speak on that.
Thank you.
Okay. I don't believe there are any further questions, so thank you all for attending, and we'll see you next time.